this meeting to order. This is the Kern Valley Healthcare District Board of Directors. It's Monday, February 7th, and we are called to order. So we have, in addition to today's agenda, if the board so approves, we have an item that we got approval of a grant that Greg has been pursuing, that he received word over the weekend, and we need action on this before our next board meeting. So there's a sense of urgency here. And so I would request that when we talk about approval of the agenda, that the motion include approval of adding the SLRP grant agreement for discussion under new business. So I'll entertain a motion.
I'll make a motion that we do what you just said, Russ.
Okay, thank you, James.
I'll second,
Do
Ross.
we have a second? Was that John or Fred?
That was Fred. I'll second.
Thank you. Okay, any discussion?
Well,
All right, then,
just
Gene, your
not-
vote.
no, I'm there on the agenda. I want to make take something off of the consent. Is this where I do it?
Oh, okay. We haven't gotten there yet, but
Okay,
okay.
okay.
So, Gene, your vote on this motion?
Yes.
John,
Yes.
Fred,
Yes.
Catherine,
Yes.
and I'm a yes. So we will be adding that agenda item for the grant under new business. And for flag salute, Tim, could you lead us in a flag salute today? And Mark, are you on? Could you do our invocation?
Sure. Yeah, absolutely. I can do that.
Thank you. All right, Tim, take it away.
All right. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And for those of you who would care to remain standing and join me, Heavenly Father, we thank you so much for the opportunity to get together and just discuss the betterment of the community through the Kern Valley Healthcare District. We ask that all the decisions and the discussion centers around making the facility a better place to provide better service and care throughout this community. We ask these things in Jesus' name. Amen.
Amen.
Amen. Thank you both. Our mission statement is here on the agenda. If Charlie Bush were still here, I'd have him read it because he did such an excellent job with his radio voice. This item C is public comment, and this item is reserved for persons of the public who want to address this board on matters under our jurisdiction, but not on today's agenda. Do we have any members of the public wishing to be heard? Okay, I see none. So we'll move on then to the fiscal year 2021 audit financial statement from Rick Jackson. We have this near the top of our agenda so that Rick Jackson can move on.
Thank you. Do you want me to go ahead and start then?
Please do, Rick.
All right. I think you have this in your packet, the audited financial statements.
We do.
Okay. On the balance sheet, which is page 8 of the statements, I'll just go there briefly.
13.
Oh, 13. Okay.
It's 8 of your packet and 13 of our packet.
Okay. The few changes on the balance sheet, your cash position is improved. And as far as current assets, that's the main thing that was involved there. Your assets limited as to use improved quite a bit because some of the cash that came in, plus you have, with the revenue bonds, you have about $5 million set aside now for different funds that the trust account set up project fund, debt service reserve, things of that nature. That's outlined also in the footnotes. You'll see a footnote there related to assets limited as the use. So with that, those were the main changes in your assets. And I believe those revenue bonds came in around this time last year. I believe so in 2021, wasn't it? I think so, the revenue bonds.
It was 21.
Yeah, March of 21.
Mhm. March of 21. Then going to the liability side, again, you can see we have some more long-term liabilities down below the current liabilities, about 14 million. We got hit pretty hard with, you probably recall the retroactive SNF bill that you got that dated back from the state of California. That had a retro rate adjustment from back in the 12-13 year. And you just never know what the state's going to do. I've heard that they may continue that. There may be some more rate increases or rate decreases, which would necessitate more payback to the state. That remains to be seen. But in addition to that too, we have reserved some of the COVID funds. You got several COVID grant related funds, and we have to file pretty soon what we call a single audit that Dave has put together work papers for that. We'll have to test some of those work papers as far as compliance with the grant requirements. And once that is completed, then we're going to file that single audit. We will attach it to these financial statements, the single audit reports, and file it with HRSA. At this point in time, we are not sure. This is the first time that hospitals have had to do this. And we are not sure what HRSA is going to do as far as auditing those grant related funds. They may come back, even though we stipulated that we use the entire grant funds for the operations of the hospital related to COVID. We're just not sure what HRSA is going to do. They may come back and take some of that back. We just don't know yet. It's too soon to tell. So
When will we know?
it might be, another year, 2 years, depending on their time frame. They're going to be, HRSA is going to be flooded. This is the first reporting period to HRSA for what they call the provider relief funds. So every hospital in the nation that had a June 30, 21 year end is going to be reporting to HRSA. So they're going to be flooded with single audits across the nation. You'll be one of many. And it may take quite a bit of time for them to get through them if they do anything at all. So again, we just don't know what they're going to do. So anyways, that's why we have some reserves set aside for that, just kind of like worst case scenario. And we'll go ahead and go over to page 9, which will be page 14 in your board packet. This is your income statement.
All right, Ross, floor is yours.
Are we recording again?
Yes.
Believe so.
Okay, so John has made a motion to receive and file the audit. Do we have a second?
I'll second.
Thank you, Fred. Any discussion among the board members?
No, sir.
Does any member of the public wish to be heard? Okay, then, John, you're up.
Yes.
Catherine,
Yes.
Fred,
Yes.
Dean,
Yes.
and I'm a yes. We have received and filed our audit. Okay, we'll move to the consent agenda. And on the consent agenda, Gene, you wanted to pull something off?
Yes, the governance committee. That's where you guys were dealing with education, right? I'd like to discuss what went on at that meeting.
Okay,
Talk about it.
all right. So we'll pull off the minutes for the governance committee meeting.
Now,
So every
can
item on,
we talk about that at some point, or we just pull it off? I
Well,
don't,
we'll pull it off consent and then we'll put it under old business. How's that sound?
okay, thank you.
So the items on the consent agenda will be approved with one motion and one vote unless a member of the board or a member of the, any member of the public would like an item discussed and considered individually. Director Parks has pulled off the governance committee minutes for discussion. Does any member of the board wish to pull any other item? Okay, seeing none, does any member of the public wish an item discussed? Okay, seeing none, then
I make a
everything
motion
but,
that we
go ahead.
put the consent agenda as modified.
as modified. Do we have a second?
I'll second, Ross.
Oh, right, okay.
Thank you, Fred. Catherine, your vote?
Yes.
John?
Yes.
Dean?
Yes,
Fred?
Yes.
And I'm a yes. So we will move on to our reports. We'll discuss the governance committee meeting under old business. And and of course,
Ross, this is Scott. Can we put it as new business item H2?
sure.
Okay, thank
It'd
you.
actually be H3 because we're discussing the
Oh,
grant. under
That's
two.
correct. Thank you, John. H3.
You're right. Okay. Three, governance. Okay. All right. So we are at item F, reports, foundation report. Do we have a representative to speak today?
I'm here.
I
Can you
see
guys-
movement in the back of the room.
Can you hear me?
Hi, Debbie.
Houch and Blood Drive is going to be February 11th, which is this Friday from 9 till 1. We're doing really good as far as meeting the quota that they require. Heart Walk is going to be on February 26th. We have 19 teams signed up for that so far and 4 individuals. Hopefully we get better participation from the hospital. We do have confirmation. We'll have those little halos out on the track like we did before. And Kern Brewery is going to provide us with the chili, so that's exciting. The chocolate and wine was originally going to be on the 10th. That's been moved to March 14th. I actually checked the paper this past week, and for some reason they hadn't changed the date, although I notified them on the 20th. So if anybody asks you, it's been changed. We put it out on Facebook. Hopefully nobody shows up. And do you have any questions?
I have a
Don't worry about the
question.
newspaper. Go ahead, Gene.
I have a question about somewhere in this last month, it showed where in June, we became a 501c3. I thought we were all along. And it stated that all the monies was to be used for the benefit of the hospital. And then the paper last week, Judy put down in there that she was donating that money to that one group that she's fond of. And she said that they would make a determination on, or make a recommendation on who to donate the money to, the interest. It implied that we would use those funds to give to other organizations. Did you see the paper?
I didn't see that, but are you talking with Kern Community Foundation?
Yes, yes.
Okay, the money at Kern Community Foundation is in an endowment. That money will not be touched until we reach a certain dollar amount, and then the foundation will be working off of the interest to benefit the hospital, equipment, different health education classes. So that's what that money was put there for.
But it's all related directly to the hospital.
Yeah.
Not no other like the Boy Scouts or anything like that, because
No.
they need money.
No,
Okay. Well, that's what it said in the paper, if anybody wants to.
I still have the paper at home, so I'll have to look.
As they recommend, she said, we'll spend it as they recommend. And,
No, we have control of.
okay, thank you, Debbie. You're doing a great job. You're gonna have to be Woman of the Year again next year.
Oh, gosh, no.
Right on. Yeah, I'm not sure the the paper is got attention to detail as they need. So I think it's reflective of some changes in personnel there, I suppose.
Yep.
That was a good point, Gene. Thank you for bringing that up.
All right, thank you.
Any other questions for Debbie? Okay, then we'll move on to our auxiliary report. Is that you today, Tim, or is Cindy in the room?
She is not here and I did not receive a report from her.
Okay, we will skip that then. Thank you.
You're welcome.
And I know Dr. Finstead is working today as a hospitalist. Is he available, or does he have anything to report?
He's
Ross,
online.
yeah, Ross, I am here and present.
Oh, great. Hi.
So anyway, January was a return to our normal meeting schedule for the medical staff committees, and we had a number of meetings. The first one was antibiotic stewardship on January 7th. The committee reviewed and discussed the recent plan of corrections. They reviewed and approved 2 new policies regarding the antibiotic stewardship program. One of the policies is a new policy regarding penicillin allergy testing. So that was an issue, that is an issue with antibiotic stewardship, meaning that if we can use penicillin instead of a broader spectrum antibiotic for people's infections, it has less effect on uninvolved bacteria, basically. So what pharmacy did, what CCON did was develop a program using the CDC guidelines for penicillin allergy testing. So that has been approved and will be starting soon. Pharmacy and Therapeutics Committee will be monitoring this on a regular basis just to keep tabs on this. The committee also reviewed the third quarter antibiotic usage and the antibiogram for December of last year, along with the monthly hospital-acquired infections. Pharmacy and Therapeutics Committee met on January 12th. We reviewed the usual COVID-19 issues, also the plan of corrections. We reviewed and approved 5 new policies regarding temperature monitoring, antibiotic stewardship program, ventilator-associated pneumonia, and 1 for scope of practice in the emergency department. We also reviewed our regular reports, including blood culture, a monthly report, CAPS report, the medication error reduction program report, along with medication shortages. Infection Control Committee met on January 25th and reviewed the monthly hospital-acquired infections for acute and the nursing center, reviewed blood culture analysis, reviewed the pharmacy biological sampling report, along with hand hygiene and MRSA surveillance, along with the Foley catheter surveillance. They also reviewed antibiotic usage in this nursing center for urinary tract infections and wound and respiratory infections. The Medical Executive Committee met later in the day on January 25th and reviewed and approved the 5 policies from PNT. We also reviewed the recent plan of corrections. The ED committee met on January 27th and reviewed the policy regarding the ED scope of practice, which just had a small addition to it. They also reviewed or discussed performance improvement goals for this coming year. In addition, they reviewed their ED clinical quality measures, medication error monthly report, blood culture analysis, and medication shortages. And then finally, the Bioethics Committee met on January 31st and discussed do not resuscitate issues. And that's the end of my report, unless there are any questions.
Board members, questions?
No questions on this end, but man, you were busy.
Yes, we were. This month is shorter and we have 2 more committee meetings for a total of 8 this month.
Oh, my
So,
gosh.
we are back in the swing of things, I guess you could say.
Well, good job.
I do have one question, Dr. Finstad. That over your left shoulder, it says Dr. Gross, man, myth, and legend. What's that all about?
I'm sitting in his office. That's what it's about.
Okay.
It's a self-report. It's okay.
Yeah, that's all it's about.
Probably a true
You'll have
statement.
to ask him. He'll be
Yeah.
here tomorrow.
All right, Dr. Finstead, thank you.
Okay, great. Thank you very much.
Thank you.
Okay, Tim, the Chief Executive Officer report.
Okay,
Anything going on?
just a few. Just, again, we had our meeting with the grand jury. 3 members of the grand jury came up to speak with me. And it was primarily a review of the periodic review that they're supposed to be doing of all county and district agencies. The last time I think they had done it was 10 years ago. And so primarily looking at making sure, again, what we were doing from a strategic planning perspective. They talked about our, they had gone online, looked at our website, kind of looked through some of the things that were on there. They looked at the community needs assessment that we had done. Very pleased by what they heard so far. They are actually going to be coming back in a couple of weeks for a follow-up visit. They want to get a tour of the hospital and kind of see everything and so forth. But nice group of people, and like I said, went well. Beginning March 1st through the 3rd, we will begin our mock survey. This is a process we go through every couple of years, whereby we kind of go through. We have an outside consultant come in, Carolyn St. Charles. She's well known to us, but we're helping us out for years. Just to kind of get a deep dive into our operations, in preparation for licensing surveys that we go through, make sure that we've gotten everything considered, that certain policies and procedures have been modified or up to date. A whole host of things, our employee files, you name it. It's a pretty comprehensive survey. So again, glad to have her back and doing that for us. Again, we welcome Sarah Ramos as our new human resources manager. She's kind of jumped in things, and she's been orienting with Deb Hoffman, who is just kind of doing her time until she retires here in another week or so. And then, like I said, Deb will be transitioning to a per diem capacity to finish off a couple of projects that she's been desperately wanting to do for quite some time. I just never had the time to do that. And with Sarah coming on and learning everything, she won't have time to do it either. So this was kind of a great way to kind of keep Deb around for a little bit to kind of help assist in her transition. She will be reaching out to Scott to spend some time on some of the idiosyncrasies of public law and public HR issues and regulation, and as well as some other folks. And so happy to have her on board. Pete Scognamillo will be joining us on March 7th as our new rehab manager. He has been in active conversation with the rehab staff. He'll be taken over by Diane Holcomb, who'll be stepping back into a part-time capacity and at some point looking to retire. And so we're waiting for him to come on board. The Kern Public Health continues to send their mobile clinic up to the hospital on Saturdays. That's actually gone pretty well, and we've gotten pretty good turnout from the public. They came up, I think it was on January 23rd. That was Sunday for that first one. They had 47 people that showed up that got tested, and then they had actually 43 that got rapid tests, another 6 that got PCRs, and then they gave out 8 vaccinations. Then last week, they gave out 47 again, rapid tests with 12 positive people, with 9 PCRs on top of that, and then 10 vaccinations. And then this last weekend, on Saturday, they did 30 tests with a couple positives and 1 PCR and 3 vaccines. So I'm gonna let Mark talk a little bit more about some of what's going on community-wise in terms of positivity rates and those kinds of things. But again, I think in the 3 weeks that they've been doing that, we've had over 140 tests done and 21 vaccinations. So very appreciative of their help and certainly giving us a much needed break here from the testing. At some point, we will probably be needing to pick that up again. We'll see. And after Mark chats a little bit about what we're observing, have not heard anything specific yet about what's going to happen beyond Omicron and so forth. Not hearing much of what's coming out there. Maybe Greg knows, I don't know. But the CMS system, our star rating, as I think I mentioned, a couple of you took a little bit of a hit this last quarter, primarily because they indicated that we had not submitted our staffing data to them through the PBJ. Yet we have a receipt from them indicating that they received the PBJ without any errors. And so we're going back and we're resending that data to them again. I think Tina's working on that. I don't know what happened there, but that cost us a star. So hopefully if we can get that corrected, we can get that back. And obviously we're continuing our efforts to get to 4 stars down there. So that's underway as well. We again did apply for a SHIP grant for our COVID activities, about 258,000 that was submitted. And so we're waiting for a response back from that. Should be any time now. They were supposed to be sending the first check out in March, which was going to be about 219,000 or something like that. Then the rest of that would be due at the end of the December 31st for the wrap-up report on those activities. And again, this covered a period going back retro to July 1st and forward to December 31st of 2022. And we submitted the plan of corrections for CDPH for our pharmacy issues. This is the 3rd time. They keep coming back with more questions and coming back with things that they didn't ask during the initial survey. So that went in Friday afternoon. And so again, I think we got some great information back to them. We did have finally get a clean survey of the environmental testing around the hood area because of some of the remediation work we did. But one thing it did point out is, again, we're still having temperature issues in the pharmacy. And so we are going to have to quickly replace the air conditioning system in there. I will probably be needing to call a special board meeting in order to get your approvals to move on that. Bob's been actively working on a set of plans with the architect and with OSHPD, HCAI, to do that. We've gotten tentative approval that they are willing to approve it on an emergency basis once they get the finalized plans, which should be there either later this week or early next week. And so, but once I get all the dollars together, then I will ask the board to meet so that we can get approval to get that moving forward quickly. So, and then the last little item I have here, and I'm not going to talk about it a whole lot, was apparently there was a bill passed, AB 1407, which is called the Nurses Implicit Bias Course. And it's primarily a mandatory training required for all hospitals who set up and hire nurses, that they have to go through a mandatory 1-hour bias training program. So wokeness has hit the healthcare environment here. And so, and it's diversity on steroids from what I'm reading. It's just, yeah, it's amazing. But this is a new requirement that we've got to go through. And so there'll be more coming out on that. If you want, you can get in and read the bill. A lot of it was originally, I think, pushed out primarily to perinatal programs and things like that. But yet the training is being made to all or general acute care hospitals and other facilities. So, and it's talking about all nurses. So, and those that have nursing training programs.
Tim, is this California?
Yes, it is.
Okay.
Specific to California. So I can only imagine where it started, but I'm gonna hold my opinion. So, but anyway, that's kind of a sign of the times, and this is one of the things we've got to do now to be in compliance. So I shared that with Mark briefly the other day.
What was that bill number again?
1407.
Thank you.
You're welcome. That's my report.
All right.
Can
Any
I ask you a
questions or
question?
comments, Tim?
Yeah, can I get a question from you, Tim?
Sure.
Tim, recently we gave you a benefit package, and there was a little unclarity. Everything seems fine, and knowing you, it is fine. Could you just tell me what your intentions or what your side, what you're giving up for what we gave you? Just a brief little statement on what you
Yeah.
intend.
The way that was set up was that I agreed to give up any future raises here at the district for the next 7 years. So that was what I contributed to that.
That includes, does that include inflation and?
Anything, it's
cost
just,
of living?
my raise stays the same as it is today, as the same it has been for the last 2 years, as a matter of fact.
So your income will stay the same for,
That is correct.
okay, Tim, thank you very much, guy.
You're welcome.
And I apologize for even asking you, knowing you, I shouldn't have asked, but thank you.
You're welcome.
Any other questions of Tim?
No, sir.
Thank you.
All right.
You're welcome.
Thanks, Tim.
Then we will move on to item 5, which is the Chief Nursing Officer report. Mr. Gordon.
Well, hello, everyone. Good afternoon. So as Tim kind of touched on, I've got some other numbers for COVID in the community. They're steadily seem to be trending downward. I think that's what we see in the county. Currently, the trend in the ER is 5.3%. That's down from about 9.6% last month. We get a report from community testing 2 weeks ago, two Saturdays ago, it was 25%. This Saturday, it's 10%. So we're pretty happy about those numbers. The community seems to be getting through this current surge. I know that our hospital staff numbers seem to be trending downward as well. Greg might be able to expound on that, but we don't really need to if you don't want to. The transportation service is currently providing 3 to 4 rides per day to various appointments. This equates to, a little less than 80 a month, which is pretty impressive. So I'm rewriting the flyer today, and I'm going to get Tim's approval before we make any large orders for new flyers. What I want to make sure that we get that out to everyone and that they understand what we're doing and how we're doing it. So we have purchased 4 new pre-screening kiosks. We're starting to develop the questions that will be put into that we're going to try to make that as simple as possible. But the AFL that came out has certain questions and things that people have to answer before they can visit or come into the healthcare facility. So we will be programming the kiosks to make sure that we're covering all that. And then that will maintain historic data regarding patients, staff, and visitors to the hospital. Right now, that's being done by hand. So it's a pretty daunting undertaking, and it's got some flaws as far as compliance. So we're trying to get that kind of worked out and taken care of. And the last thing I have is we just received information about some grant money that's been set aside for rural hospitals to develop and purchase real property for the purpose of providing some much needed behavioral and mental health services. That's a huge undertaking. I don't know if we have the resources at this time to kind of do that. So obviously there's going to be a lot of discussion regarding if that's something we can do. Half the time, more than half the time, the problem is getting staff to be able to staff a service like that. So again, we're starting down this path of looking at what it's going to take to do that. So,
And some of that
otherwise,
money, some of that grant money was to be used for to construct a clinic or a building, to buy property, or to renovate, repurpose existing real estate assets and so forth. There's such a need for mental health services, primarily on an outpatient basis is what they're really looking for. And so even they talked about mobile as one option as well that they might use the funds for. So, we'll take a look at it here shortly and see if there's some application for us.
Is there a
Yeah, and
possibility
that's
of,
my report.
hey, Mark, is there a possibility of using that grant money to purchase the building that's next to our clinic?
That's a good possibility, but again, you still have to have the resources to staff something like that. It's not an easy undertaking right now.
Okay, so we do have some staff, right?
We have
Ms.
a
Wiley?
staff.
So we could put Ms. Wiley in there and then a couple of those remote monitoring computers. Those telemedicine kiosks.
Well, that's again, we're going to be talking about that and trying to see what it all entails.
Okay. Well,
It's
it sounds
a-
it sounds like might be a real possibility there. So I'm glad you're looking into it. Thank you.
You're welcome.
Any other questions or comments for Mr. Gordon?
No,
Ross,
sir.
I have one other item I need to present on my report. So if you don't mind, I would like after, if there's no other questions for Mark.
Thank you, Mark.
Go ahead, Tim.
I just want to alert the board that I will be going out for surgery for a knee replacement on February 17th. And not sure how long I'll be out. Hopefully we'll have a little better answer on Wednesday after I go meet with the doctor. So I'll just keep you all apprised.
Mark, are you planning to leave that town anywhere soon after Valentine's Day?
No,
Good.
my knees are fine. My back is a little sore, but we'll get over it. Get
All
through
right.
it.
Thank
Both
you.
of you, thank you.
Carrie's a new CIO, so we'll enlist him.
Tim?
Yeah.
Tim, since you reopened that, Heidi, could you possibly, when you do a summary and you say, well, Gene talked to Tim, it doesn't show much. Would you mind doing our conversation verbatim?
She said, of course. Yeah.
Is Heidi there?
Yeah, she said, of course.
Oh, okay, thank you.
You're welcome.
Okay, item 6, Chief Financial Officer Report, Mr. Recupero.
Thank you, Ross. And before I get started, as it relates to the audit, I wanted to give a special thank you to Barbara and all her work. She's got a great reputation with Rick and with other financial people. Her audits are always turn out very good, and this year was no exception. So thank you to Barbara for all her hard work.
Thank you. Reputation.
And the other thing I wanted to do before excuse me, go ahead. Did someone have a comment?
Don't think so.
I think so.
I think it was sneezing, Dave.
Oh, okay. I was going to give you a little bit of an operational update. Some new priorities have come up for me personally that will challenge my time allocations. 2 big projects. Rick Jackson referred to the single audit. That was a phase 1 application that I spent a lot of time on and submitted in November. And now they just rolled out phase 2, similar type of reporting documentation. I have to now dive into that report. So in effect, what we're talking about here is what happened in phase 1 is we were able to justify, at least tentatively, 4.5 million of COVID money that we said we used appropriately and we don't have to pay back. Thankfully, this phase 2 application only includes about 180,000. So it's for a 6-month period from July of 2020 to December of 2020. During that time, there wasn't a lot of payments coming from HHS, about 186,000, but they have it broke out separately as a phase 2 application, and it's just as much paperwork, even though it's not as much money. So I will be diving into that. The other thing going on is the annual state dish audit, the 1819. That's how many years behind they are. We haven't done too well the last couple of years on that. We've had to pay back the state disproportionate share funds, which is about 100 grand a year. I hate to leave that kind of money on the table, even though it's a very demanding audit and it's going to take a lot of time, but I'm using the people that I respect to give us either the okay or not okay, that from a reasonable perspective, we have a chance to prevail this year, and then we'll go after it again this year. So those two projects, what I really want to get to is being a big picture CFO for you guys so that we can really continue on with the ambitious undertaking of this master construction plan to really have a lot of good tools at our disposal in terms of financial strategic planning, and cash flow projections. And I'm making good progress on it, but until I really get it all tied together, I'm not willing to share it with you guys yet. But it's a 7-year cash flow pro forma that basically asks the question at the end of the project, are we still going to have any money left? And obviously we better have money left because we have a hospital to run. So we want to make sure that we create a roadmap and a plan that if anything deviates, we can get back on track and figure out what we need and kind of use it as a tool and a certain amount of confidence we can have that the direction we've started is achievable, and we have a good plan to make it happen. So that's still not, you haven't seen any of it yet, but I have spent a lot of time on it and it's coming together pretty nicely.
Dave?
Yes.
I'm listening to Tim. He said it would happen. So all we got to do is fit him for a contractor's uniform. If it's not working exactly right.
Well, anybody that reads the newspaper, if you follow healthcare construction projects, a lot of things can go wrong. And so it's the job of the CFO to create contingency plans and those kind of things. So
thank you very, very much.
So let's go into the month of December. I'm going to get the shared screen. And
looks good to me.
I thought I was going to be able to pop right into this. Okay, here we are. Can you see the screen? I'm going to make it a little bigger. Okay, we're on the balance sheet. Can everyone see that?
Too big, Dave. Go back one more.
Okay, I made it too big.
You can slide it
There
to
you
the
go.
left.
There you
that way.
go.
Okay, page 51. And I wanted to talk about this top percentage that I added to the balance sheet, which is basically just the formula that takes the line item number 4, net accounts receivable, divided by number 2, gross receivable. That percentage we can say equates to what you would call a collection percentage. How much of what we bill out do we actually expect to receive to the of actual cash? And this new percentage is one of the lower ones we've had since I've been here, and I base it on empirical data from the business office. As they get claims adjudicated every month, we look at the percentage of write-offs compared to the collections. And the reason why this 20.8 it's a lower number, and why it's significant is what we talked about, this cash flow pro forma that goes out 7 years. There's a certain percentage collection rate that's assumed in that pro forma. If all of a sudden that number even goes down by 0.5%. We're sometimes talking about millions of dollars that could affect our ending cash balance if we don't do a good enough job in making sure that we're receiving everything that we deserve from the insurance companies. So that we're going to keep a close eye on that. Part of why it went down so much in December was there was a lot of claims adjudicated by the state of California, the Medi-Cal program, which is the worst payer, and that caused the percentage to go down. So the budget that Chet put together was about 22% in average across all payers. So this is a little bit behind budget. And just to give you a context of it, all the gains that we had this summer, because it was busier than expected, we could lose that to the bottom line if the percentage drops, let's say below 21%. We might actually be slightly below budget on net revenues if our collection rate doesn't improve a little bit from the 20%. So a little bit glass is half empty, that we're going to keep a close eye on that number and see that how much it's going to affect the projections of how much we expect to have at the end of the year. The 7-year pro forma does assume with the higher IGTs that we maintain a positive cash flow every year. So one of the pieces to that positive cash flow is also the percentage we collect on our bills. So all those pieces have to come together to make the whole picture work correctly. So we're going to keep a close eye on that. In general,
Hey, Dave, a question.
Yes.
Dave, question on that net to gross percentage. Is that within our control?
It is, to the extent that you have third-party denials and how you challenge them and how you have, excuse me, good documentation can affect it slightly. Because I haven't done a deep dive analysis yet of our current business office, I can't tell you one way or the other whether or not we've been doing everything possible. We may spend a couple dollars consulting to bring in some experts to make sure we don't leave any money on the table, and do some more training. Anytime you hire a very good, competent staff person and make her the manager, she may or may not have all the experience and training that she needs. So we're going to make sure we give her the tools to succeed.
Okay, thank you.
Dave, with the recent hospitalizations, the increase with Covered California and a few companies, the maximum out of pocket is like 88,000 or 8,300. There's a few variations, and a lot of people weren't ready for the maximum out of pocket, and it's going to be quite a bit. How do we deal with that? Could we help them finance it, or what do we do with that money whenever they've been in there and the total bill is like 250,000, and yet they're responsible for the 8,000? How do we handle that?
Yeah, you asked that question last month, and I told you it was a good question. I did not research it like I said I would. So now you've asked me a second time. So I better be ready the next time.
The more we can recover it, the better we deal with that situation, the better off we'll be.
Absolutely.
Okay.
Good question.
Thank you, Dave.
And I got to meet with Debbie, and we're going to meet on the budget. We're also going to meet on other things. So that'll be near the top of my list to make sure I understand, because we do have yeah. Okay.
Thank you.
Overall, like Rick said, we are sitting in a real good position. What you'll see on my new cash flow projections is a combined picture. What Chet has decided to do, and many organizations do it this way, is he's kind of split up the cash in about 5 different buckets. So it's kind of confusing to really kind of trend the overall picture, because line 1 is one of the line 13, go down on lines 14, 15, 17, and 19. Those are all potential dollars that can be used either for normal payroll or for capital, but the board has decided to to do it the way they have in terms of putting it into certain categories. And we can look at it like we currently look at it, or we can kind of put them all together to see overall trends. If we trend it out, for example, going back to 2019, these numbers collectively was about $14 million less than they are today. So a lot of really good progress has been made the last couple of years. Let's move on. I'm going to pretty much go right to the P&L, which is page 53. And we had a slower than normal months for this year, down to 9.2 million in gross revenue on line 6, and that was 6% below budget. And so we were 3% on line 13 below budget total revenues. Expenses we hit exactly less than 1/10 of 1%. So we did miss budget for the first time of the year, 88,000 in operating. The bottom line was off by 35,000 for the month. And again, we really had a busy first 3 months in the summer, but since then I'd have to characterize our year as being pretty much break even since the busy summer. The year-to-date picture, because of the busy summer and also because of some of the numbers from last year that were stated as payable, that we've determined that we can collect that money, we can bring that into the bottom line. So about half of this bottom 1.8 million represents prior year, but the rest of it represents most of what was earned the first couple of months of the fiscal year with the busy summer. But you can see we're quite a bit ahead of budget on total surplus, 1,466,000 ahead of budget for the year. The other thing I can point out to you, if you look at line 28, this total operating expenses, and expenses is truly how you talk about what's discretionary and how you can improve your bottom line. Obviously, controlling your cost is the area that you have the most control over to a certain extent, even though there's a high percentage of that that's not discretionary either. But we've done pretty good this year. This 15,563,000 after 6 months for the current fiscal year is only about a 2% increase over the first 6 months of last year. 2% on the expense side is a pretty good indicator that we're managing our expenses pretty well. As you know, most businesses, the way inflation is going right now, it's a lot more than 2%. And so we should feel pretty good about how we've done the first 6 months, at least compared to where we were at the same period last year. Now, I compare that because one of the things that was on the negative side of how we finished fiscal 21, the audit that we just received, on the expense side, that was an 11% increase in fiscal 21 compared to fiscal 20. So thankfully, so far, we're on track to get that number down significantly from what happened in fiscal 21. Now, having said that, there was a good reason why we were 11% higher last year, and it was all COVID related. And if we wouldn't have been able to show that documentation on the what I had to put together for the single audit, we probably wouldn't have been able to keep all our COVID money. So it was probably a good thing that our expenses were higher last year so that we could keep all our COVID money. So I don't know if you're understanding that kind of nuance. It's a different type of thing going on with all these one-time events when you have expenses and revenues on line items related to COVID, which normally don't occur. Other thing I wanted to point out to you, a little bit of a nervousness when I compare the column of December here to the last 5 months right before that. On line item 28, you can see expenses were very consistent all the way up till December. Now, and it went up. Now that's about a 5% jump. It went up from November to December. But then when I looked at it closer, December typically is a higher than average month. You have a lot more non-productive pay with holidays. And so it doesn't concern me as much, but I think in general, I think we are getting into a phase in our operations where there has been maybe some pent up things that we needed to spend money on. So we're going to have to keep a close eye on the total expenses to make sure that we are careful not to have that go up too much, even though a lot of those are good justifications for things that we absolutely have to do. But one of the items that has been the biggest challenge is this contract labor, and that's something that we have very little control over. And that's an area that's probably gone up the most, along with supply costs for this current year, is those two categories. Other than that, you can see we're well ahead of budget. I was just trying to paint the glass half empty today, so I didn't get accused of always being a Pollyanna CFO. And that's my report.
Questions or comments for Dave?
Dave, I had one quick question on page 52, which is the liabilities section of the balance sheet.
Sure.
The 12.1, that's the new revenue bonds, right?
Yes, it is. This is line 15. That's the new bonds.
Okay.
We did get about 5 million of that for the construction project, and that shows up on the asset side right here. I believe this is, we call that it really could be the construction reserve. We could maybe relabel that. This is the line item from that $12 million borrowing.
Okay. I was just curious, that's all.
Okay.
Thank you.
Any other questions?
That bond and that money, if we don't have enough, I know you're doing a projection, that has to be paid off before we can borrow money again.
Well, I did spend some time with the attorneys on that issue, and we do have a way out legally, and it's a fairly common thing that because we have good documentation that the timing of us spending that $5 million before the 3-year time frame that's in the regulation, we have already filed for an exception clause, and the attorneys have agreed that this is a sound document, that if in the rare event we have an IRS audit, we would not be penalized at all by nuts if we in fact weren't able to spend the money in a 3-year time frame because of the documentation of the OSHPD denial. And we also have to continue to show that we're doing everything we can to continue that project along, which I think we'll be able to show that.
Okay, this is going to be a sort of a silly question, but from everything I see looking at it, we're probably going to need to do one or two things: operate the hospital more profitably or go to the community. What do you think?
I think we should continue to try all of the above. There's nothing wrong with going back to the community every couple years or every year and test the waters. I've worked with a couple of consulting companies that do a good job marketing the efforts, and recently, that where we live here, they just recently approved a parcel tax and that's like $3 million a year for the local district hospital. And they have really beautiful brochures and those kind of things. And it's obviously a risk you take. And I know the history here at Kern Valley hasn't helped the vote, and you have to get a 2/3 majority. So it does require a certain amount of finesse to be able to get enough people to vote for those. But I don't think we should give up on that. But
Dave, we agreed that we wouldn't get ourselves in a position where we have to go to the community. We would
exactly.
be where we can stop at any point. That's what we agreed to. And so everything should be set up to where we stop the construction at any point, and we don't have to move forward to go to the community. We just work and make the hospital operate properly, do a little better job.
Well, there's a third backup plan. I had a longer discussion with Gary Hicks. Because we've been doing so well, he thinks there might be as much as another 10 million out there. That's the type of borrowing that would partially pay for itself, because we're a critical access hospital. On the cost report, we'd get a part of that back every year of paying back that new borrowing of a USDA loan, community loan. I'm not suggesting that I'm recommending that. I'm just saying if we run into trouble, we do have some other backup things that I've been researching behind the scenes.
Now, like the skilled nursing, we're into this problem now with redoing. Are we putting anything aside, like 500,000 a year or anything, to be able to pay for what we need to be done when the skilled nursing needs attention?
Yeah, well, that's a good question. And we probably need to put a whole separate plan together just for that. I have not started on that. I haven't really discussed it much with Tim. But those are the types of things we have to, not exclude anything that we know we're eventually going to have to deal with should be part of the plan.
Right. And, we don't want to end up with any of those hospitals in Bakersfield taking us over.
Absolutely. And those things happen, district hospitals every year, are running into that kind of trouble where they're facing solvency issues.
But we're not going to get into that position, right? We can stop our spending, right? Or borrowing.
Well, and that's what the budget process is for. And we've started our meetings now with the managers, and well, a lot of them we're trying to make sure that they understand the right mindset, that we really got to be careful how we spend our money.
Cool. Thank you.
So Tim, now that I've impressed everyone.
Good job, Dave.
Thank you, David. Okay, so that brings us to old business, and there's none. And new business, now we have 3 items under new business. The first item is the Building and Planning Committee composition. And Jean, you wanted this on the agenda. Would you like to speak first?
Yes. Scott, are you there? I looked at our bylaws. The committee itself normally operates like the Finance Committee, and you got 2 board members. You go over it, you figure out what's the best thing to do, and you take it to the board on either the consent agenda or whatever. And by having the whole board, it takes the community away from seeing a lot of the activity. I know back 3 years ago, before I was on the board, the only thing we saw, the community, and it was before Zoom. I don't know if it was published properly or not, but I was never aware that we could go in and at least listen without participating. And so it seems like having a committee and special board meeting together is not legal, at least for a long period of time. Now, it might be legal for a short period of time, like an ad hoc committee. What's with that? There's so many reasons why it's wrong. And the biggest part is the transparency. We're able to do stuff that the community is not even aware of until we've pretty much done it. And they can look backwards. But Scott, tell me, what is it?
Well, let's start off with, it's not illegal. So running a special board meeting concurrently with a committee meeting certainly is not unknown.
Okay, you said, does that mean separately or together?
Together.
Okay,
So it is not a practice that I encourage, but this board decided several years ago that all members of the board wanted to be part of the construction committee. And so that's how we set it up.
okay.
Everyone wanted to have input into the process, and I totally understand that. And the board members, I believe, felt that it was not an efficient use of time to do it as an agenda item during a regular board meeting with all the other items that were on an agenda. So this is how you decided to do it.
Well, not us. We didn't. This is a totally different board. There's not one board member here now that voted for that. Not even John.
I wasn't looking.
Pardon me?
I don't recall when it started, but the board, there's continuity of the board. I mean, when I say the board, I mean throughout time. So this was a decision of the board. You guys can change that decision if you want. You
Okay,
have
could the
complete
board,
freedom to
could the
do that.
board participate in discussion? Is there a way, but not have a vote, just have the two board members?
Absolutely not. Anyone who is not on the committee cannot participate in a committee meeting, because you would then be conveying your thoughts, ideas, and preferences on business items outside. And if there's 3 or more of you, you're doing it outside of a scheduled board meeting, and that is a clear violation of the Brown Act.
And the other part is like they have taken over the finance ability, just like Ross going ahead and overriding the finance committee and paying Greenbaugh. I said I would never say that word again, but I had to. So, you know, I think
This is
it's not transparent and it's not the right thing to do. And it's sort of morphed into something that's was never intended, or at least this board, maybe we should look at it.
Well, you know, again, I want to question too, Scott, that, you know, again, we talked about the normal committees we have, the two members of the board. You may have some public there or not, but it's not required. With all the members present, you are required to have that as a public meeting. So therefore, it seems to me it would increase transparency. No, why is that?
Your standing committees are subject to the Brown Act. You have to post agendas and they
Yeah,
have
right.
to be open to the public.
Right,
Now, as a practical matter, you may not have members of the public there,
right.
but that may change from month to month, meeting to meeting, topic to topic,
Yeah,
right?
It's making it a hardship for the public to be there. They got to be at a board meeting, they got to be a special meeting, and if we could operate normal, like most places do, it seems like it would be a better thing to do. How would we do it? Would the board have a special board meeting and talk about it? Or how would we proceed with, there are a lot of reasons, and I'm not good at reading my own writing, so
I'm not sure what you're asking. Are you asking how?
okay, I'm asking to get rid of what the old board did. The old board did something that, and I'm gonna be honest, and this is the way I feel about it. The old board meeting did everything Tim told them to do. Now, I'm not saying that there's
I take
anything wrong
exception
with
to
it.
that, Gene. I'm sorry.
Okay.
I'm gonna go on record. I'm taking exception to that, okay?
Okay, go on record. Now, what did you say it's on the YouTube? After Prop Q failed. You said, I just did what the board told me to do. It's not
What are you
my
talking
fault."
about?
Yeah, Gene, so we're talking about the construction committee. So are you asking your fellow board members to stop having special board meetings at the same time?
No,
Because the
no,
special board
if we
meeting-
had something, there's so many times they just cancel because there's nothing to talk about. If we had something that was gonna take time and be involved, that would be excessive on a board meeting, that we could incorporate it over. Maybe have a special board meeting at certain times at the request of the board or Tim or whatever.
So your construction meeting is a standing committee that meets on a periodic basis.
Right.
There's nothing to discuss. You cancel that meeting.
Oh,
The special
okay,
board
the special,
meeting-
the special board meeting, we don't have to have every month.
You determine that month by month. If you decide that you just want construction committee to meet and the other 3 directors don't need to be there, don't post the agenda for a special board meeting.
Okay, it's things like the green box, and you come down and Russ listened to Bob. Bob says, "Oh, it's okay." Well, it's not okay. A verbal okay is not okay. That we need an invoice. We need stuff written down so we can go back and see it. We can't go back and say, "Well, Bob said it was okay." It's
We
just
have
wrong.
invoices, but we have invoices for the work that's been paid.
There's never been a payment that was not backed by. an invoice.
Okay. Example. We don't have an invoice for the work that was done that wasn't billed for. We need an invoice saying no charge. We need something showing. That's not being done. Now, they agreed to do it or agreed to try to get it done.
All right, so let's
Hey,
get
Gene?
back to the
Yes,
topic
yes.
for this item, which is the Building and Planning Committee composition. And Gene, are you asking if your fellow board members are open to not having a special meeting every
I'm
time that
asking-
committee
yes.
meets?
Yes, I'm asking if they would consider operating the way it was originally set up as building and planning, two board members, just like the finance committee and all the other committees. And then if there's a need, we could involve the whole board if it's something special happening, there's something going on. But we need to keep the public involved at the one general meeting they should be involved and should know about. The board meeting.
So I'm going to turn this back over to Ross then, because that's an internal governance issue. That's not a legal issue. And so if the board members are fine with that, then that's up to you guys. And I'll let Ross handle that portion of it.
Okay, so I would like to weigh in on this. My own personal viewpoint on this particular issue, and I wanted to seek the board members' input on this, but I'm going to start with my thoughts on it. I don't share Gene's concern that the public is being shortchanged by having a special board meeting. And the reason is, it's a posted agenda. Every board member is present. The meetings are recorded so that if the public cannot participate at that time, they can review it and understand what has transpired. So I don't agree with Gene's perspective on this isn't transparent. It's completely transparent. It's as transparent as our regular board meetings.
Is it posted?
And so I disagree with Gene on that statement.
Is it posted? You're saying something.
Yes,
Everything
It's
is
not true.
posted.
Gene. Hey, Gene,
it is posted.
this is my chance to talk. That the posting for the Building and Planning Committee meeting mirrors that of a board meeting. There is no difference. So I just don't share that perspective that Gene has. To me, the structure that we have right now, where we're meeting as as a special board meeting to discuss the building and planning committee issues. It seems to be working operationally for the board. This is the first I've heard that there's objections to the way that's being done. Yeah, and if we need to revise the bylaws so that they're consistent with the practice that we're doing, then maybe we need to change our bylaws. I just don't see where the deficiency is, and I'm missing that. I don't share Gene's opinion on this.
Let me just say, the bylaws are not inconsistent with what you're currently doing. The only thing you're doing is you are posting and holding a special board meeting concurrently with the construction committee. There's nothing illegal about that. That's not contrary or inconsistent with your bylaws. The board can call special meetings when it's appropriate, and the board has decided to do so whenever building and planning meets. The board is free to change that at any time that the board desires to do so.
Thanks, Scott. John, Catherine, Fred, any thoughts on this issue?
I have one if you're like it to be my turn.
Go ahead.
Hey, Gene, I have a question, please.
Okay.
My concern is if we move this to only be a two-person item, 2 board members and a team, I'm more concerned with the fact that we have a number of individuals who don't read our agenda, don't read our minutes. Something's going to get thrown into the consent agenda and get missed. Forgive me. I like to personally believe that with all of us being involved, that it gets posted and that video is open for everyone to watch accordingly. I have a personal belief that we have a lot of individuals who would like to be a part of it, but choose not to do it by reading our minutes. And maybe they watch the videos, maybe they don't, maybe I'm off base, but I believe having all of us involved at one time for working amongst ourselves is a great thing. And you could tell me I'm wrong. I'm okay with that. I'm just looking for your perspective as well.
Okay, I have trouble finding you. Ross says it's on there, and I believe everything Ross says, but I can't find it on there. I find the board minutes, but the building and planning, I don't see them.
Well, then I would have a problem with that as
Posted,
well.
Heidi, are those posted?
It is posted. I can show you where to find it on the website.
Okay, can you tell the public how to find it?
If
It's in the
somebody
same
asks, we would
location.
certainly show them where to find it. We've not had anybody inquire, so we're assuming they're able.
Well, so then it's sort of in darkness because they don't know how to inquire if they don't even know it exists.
This is the board meetings.
They're in the same place as the board meeting.
It's all on the same page,
It's on the same page.
and they're in chronological order.
Okay,
Okay, because if it's recorded and posted like everything else, I generally like that. I think that's a great idea. I feel that we need to be more transparent versus,
okay, what about them doing the finance then?
I'm sorry, sir?
What about them taking over the finance?
What about who taking over finance, Gene?
Well, Ross has taken over the finance.
I'm stepping out of that one. I'm not agreeing with that. So I would step away from that comment. My opinion is Gene and Catherine handle the finance committee.
Okay, Ross, what do you say about that?
I didn't take anything away from finance committee.
You signed the checks when you were told not to.
No, I signed
You
a check.
said
that was
you
approved.
overruled me and signed them at the last
I
minute.
signed- No.
It's recorded.
When a
You
check
said you
is presented to
overruled
me,
Gene and signed a
shut
check.
up and let me talk.
Okay,
I signed a check that was presented to me for signature because it had gotten all the approvals. I signed the check because I was asked to sign that check and all the documentation was there. That's a separate issue from reviewing invoices from Greenbow. Completely different issue.
Okay. Why did you say you overruled me and signed them at the last meeting? It's recorded.
What I said was that the invoices for Greenbow were now going to be reviewed by the Building and Planning Committee rather than just the Finance Committee, because the Building and Planning Committee consists of the entire board.
Okay. Okay, Russ, whenever I agreed to give them $1.2 million from looking at their past invoice and the way they did their billing, I said the only way I would do it is if Bob verified each invoice at the Finance Committee and showed us what was going on. So we didn't end up in the same thing we did with 4-year-old invoices, not knowing what was really going on. So it should go to Finance.
So I don't know that the board has ever voted on that particular issue, Gene. I know that that's what you want. I don't know that you have the authority to order that.
Well, it should go through Finance. What are you talking about? You're talking about Building Planning Committee and planning on construction and whatever. Why would they get involved in the invoices and pay just whatever? I don't understand.
So we have an internal process, an internal operational process within the district to approve payments. You know, for Greenbow, it involves Bob, it involves Tim, it involves Dave, and it involves Barbara. If they all sign off on it, you then want an invoice to be approved by Finance Committee before it's signed by anybody? It just doesn't make any sense to me. And by bringing up the Greenbow issue, we've now looked into this in detail, and we found that there was nothing wrong.
No,
There
you
was
didn't.
never an error that occurred.
You didn't. If you want to open up, let's order a special investigation on just their invoices for the last 4 years.
We've had that special.
No, we didn't.
investigation
Let's
for
get an
the last
auditor to look
6
at it.
months, and we found that there's nothing wrong.
No, you looked at it and thought it was fine. Let's get somebody.
You keep beating this dead horse, and we're not getting anywhere.
Excuse
Gene.
Okay,
me.
we're getting
What's the
somewhere.
point?
When you
Let's go.
said you overruled
Gene.
the Finance Committee,
Gene, here's what I would think at this point. First conversation we were having was about all the board members being on the Building and Planning Committee. And then that's recorded and that's posted. I think we should stay that way because, for one, I don't want to miss those meetings because they seem to be very important to the community, whether the community participates or not. That's our job, is to stand up for the community. So me personally, I do not want to see a change in that. Second of all, if it does go to compliance or the building and planning, then it's all 5 of us, not just 2 of us. But being on there, I think we're kind of combining the 2 as far as those invoices go, or anything for the building and planning, because you and I are finance. We can always say, wait, we wanted to send that to finance before we want to have a better look at it. So finance would also be involved in it at a different time. So we can take it off any agenda and take it to Finance Committee when you and I choose.
but that's not what happened.
No,
Russ
but
just
it's
signed
what
the checks
we-
because
It's what we can have happen. And it can also, part of the deal is, even if they would ask me to sign it, I probably would have signed it. Because it was for work that was done and things that we had already discussed, because I remember discussing it. And as in, the 2 of you, I know there's underlying issues about not agreeing on things. And I understand that because I have my own. I just, I put them out there differently, I think. But I think for the point of this meeting right now, I understand your concerns and questions only because you've continued to voice them, and I know they haven't been satisfactory to what you want. However, that may be a personal issue between you and Ross, and maybe that should be just the two of you guys meet and figure that out. Because then it's not in, error of the Brown Act or anything like that. That may solve a lot of issues. And you can maybe meet with Scott, or maybe meet with Tim, or someone else as a third person that's not on the board. But I think for this meeting, I, for one, am not willing to turn the planning and building and planning meeting over to just two board members, because I want to be part of it and be able to speak at it, because I like to hear myself talk sometimes. I don't know. But I think, and John, you speak a lot at that meeting also. I just think it's an important one for all of us to be on, because it's huge. It's huge. And for those that, if hopefully we don't have to take anything back to the community, hopefully with the way the finances are working, and I've even heard you agree to that, that there's got to be a plan, because for getting the monies ourselves, we don't have to go back to the community. And then David said he's got a third thing that we could probably use. And you know what, maybe we should move that to the second process instead of the community always being our second fallback. But I just think that, I think a lot of things, but I think it seems more of a personal thing right now. And I don't think this is the place to do that at this time. That's just my opinion. Anybody else can, but they're not. I usually step in front when everybody says, okay, who's in favor, say aye, and you look behind you and no one's with you. But that's all right. I'm okay with that. But I understand your point, Jean. I understand it. I am glad that you have the business sense that you do. And sometimes it's even over my head. But for us to be the board that we should be, we should have these disagreements. We should have these, but I think we need to handle them differently. It's just my opinion.
I agree. It's just, I want clarity on that damn building. And if
I know
we
you
do it
do.
through finance or do it through there, it's fine, as long as, Dave, can you give any input on that? What we're talking about?
I think we're looking for the board's input at this point. We haven't heard from John yet.
Okay, I'm done. Thank you. Sorry.
Okay. Well, I think the last time the bylaws were amended was 2016. And I think that was right before I got on. So they probably changed that, right? Because I don't remember us voting on that
We
when I
changed the bylaws.
was regarding the committee.
Just how we were gonna set the
We
committee
just
up.
posted as a special meeting so you can all participate. So the bylaws weren't changed with that change. It
Okay.
was just a mechanism to allow all board members to participate.
Because everybody wanted to
Because it was
participate.
such a big deal to everybody. Everybody wanted input and it was just delaying it, and all these things kept coming up in the board meeting. So they made it a special meeting as well. So you guys could all
Yeah,
participate.
prior to that time, we weren't doing any construction, and so the committee didn't even meet. I mean, the first 7, 8 years I was here, it didn't even meet,
Okay.
so.
Well, I'm in favor of keeping it the same because I think it just would tie up this meeting. It would go on much longer. So you already have another committee going through everything. And according to the bylaws, the Building and Planning Committee does overview capital expenditure requests related to construction and planning. So I think that kind of goes hand in hand with the board, the full board approving things, or like you said, Catherine, if there's things that do come up that have to go through finance.
Yeah, we can always just say, wait, we're not, and talk later, or maybe the finance should be a meeting before the building and planning. But I just think that, sorry, it's Fred's turn, I think. I just start talking. Sorry.
Catherine, I agree with
John,
you.
any more
I agree with John. I agree with Ross. I truly believe the 5 of us need to be involved in those meetings so that, and also in turn, they get posted, the video gets posted, and the public knows exactly what's going on if they wish to join and chime in.
And I do go back and look to see that they're posted, since we did have, an issue before, and I was actually personally contacted on that. Maybe we want to look at posting them in two different places. I don't know. Maybe we post them and then we can post them like on, if we have a page, or on the forum page that Jim Dietzel has, where a lot of people look on that. Maybe we can post them at a second place there, but maybe there's just other ways we can make sure it's even presented more to different aspects of the community, because they may not always go and look at it one place, but we'll see it on another.
Correct.
So,
So I think that, I'm sure under Scott's leadership that the way that we post our meetings now is legal. I believe it's completely transparent, and our postings from our website can be shared to any Facebook page that anybody wants to share on their own, to increase transparency. I don't understand the problem that Gene's trying to solve here. It's like it's a problem that he's identified, but I don't understand what the problem is.
and that's why
And I don't
we
know.
are a board of 5. Bottom line, I mean, people may not understand something I have an issue with either, and that's why we have more than 2 or 4. There's a board of 5, because everybody's perception is different, or we see it different, we hear it different, and that's important to each and every one of us. And I may be trying to explain something in a way I'm thinking everybody should understand it, and it doesn't always work that way. So again, I just think we've talked about it for a big portion of this meeting at this point, and I would just like to move on.
Okay, thanks, Catherine. So Gene, back to you. It sounds like the board's not interested in changing the structure of the Building and Planning Committee meeting and meeting as a special board, or having a special board meeting. Does that help you? Does that resolve?
It helps me a lot, Ross. I'd still like to ask Dave his opinion.
Just to set the record straight, Rick Jackson spent a lot of time during this year's audit pouring through all the documentation that Barbara sent him on the construction approved invoices and payments, because those are big ticket items, and he spends most of his time when he sees the dollar amounts so high. And so he did not find anything that was noteworthy that needed to be reported separately as audit adjustments or any type of operational problems. So my point is we do have third-party review of those types of issues. Whether or not the finance committee is the sole, that's a board issue. I'm not going to pipe in on whether or not building and grounds should have be on the same footing for approving invoices. That's not, I don't have an opinion on that.
What's the third-party review?
I'm
The auditor.
sorry. I was talking about Rick Jackson. The auditor is the third party that is independent, doesn't have anything, one way or the other, and he's going to look at it from a perspective of whether or not whether anybody got paid incorrectly or didn't get paid, or there was some improprieties, and and he spends a lot of time looking at that.
Okay. Then Ross, I guess from my standpoint, we'll just have to ride it along and try to do the best we can. So I'm happy with doing what the rest of the board seems to want to do, and that's just keep trucking. So.
Okay, Gene, thank you.
Thank you, Jean. Thank you, Ross.
Okay, we'll move on to item H2, which is the up here, a memorandum of understanding with the California State Loan Repayment Program. And is this Tim or Greg?
Greg.
So, yeah, I received this MOU on Friday evening after the agenda already posted. I was trying to get it sooner, but the state processes all of these all at once. So this is the same type of agreement that we process for Dr. Lopez and our pharmacist and other PAs in the past. So it's a 2-year agreement. This would basically allow Cody Bogarelli to have $50,000 worth of his student loans repaid. It would be 50% from the state and 50% from us. So we would have a $25,000 obligation over the next 24 months. So we've been paying those in monthly payments, and basically we report those to them regularly. This one is always a weird one because I'm the one that manages all the day-to-day things with the grant, so I have to be the signer on this. So if you're willing to approve this, then like last year, you'd have to authorize me to sign the agreement.
I'd like to make a motion. I've read it and I'm sure everyone else has, that we approve it.
Yeah,
Thank you, Gene.
I'll definitely second that, Ross. I think it's a great thing. Well done, Jerry.
Thanks, Fred. Does any member of the public wish to be heard on this item?
Yeah, this is Scott. Let me just, Barbara and I have been emailing about this morning. And Barbara, have you connected with Dave on the tax issue?
No, but I believe in your last comment that you told me which way it should go.
Yeah, so I am not a tax advisor. Dave is probably your tax advisor, but I want him to be sure that he's in the loop on that issue. So 25,000 that comes from the state is not considered to be income. And so what the issue Barbara and I were talking about is 25,000 paid by the district goes onto a 1099. And then the other 25,000 we just don't report because it's not considered under federal regulations to be taxable income. So the how that actually works out in terms of the district's accounting and record keeping, I don't know how you guys handle that, but Dave, did you have a different opinion on that, or do you think that that's correct?
Yes, I think what you said is correct. However, I can run this past a couple other people that I respect and really are experts at district tax law, and make sure that we handle it correctly.
Are you talking about the tax ramifications for Cody? Is that what you're referring to? Okay, I just wanted to make sure.
And for the others too.
Well, and what's reportable for the district? I guess you're running in as a 1099 and not a W-2, so it's not a payroll tax issue.
That is correct. That's my understanding.
Yeah.
And I can get some feedback too from Nathaniel at the state loan repayment program too.
They specifically don't want to give you tax advice.
Yeah, that's true. I did read that.
So the thing is there's going to be no tax implication for the district.
Correct.
Any tax implication would be for Cody. And so we don't want to underreport his income by 25,000 and then have him surprised a year or two down the road when the IRS comes back and says, well, look, we got this report from the state that says they paid 25,000, but it's not on your 1099. Those are the things we want to avoid.
That's correct. The issue is for Cody. Yes.
And last week I did talk with Cody and told him that I can't tell you what your tax implications would be. So he understands that, he may be responsible for that as income.
It would be over a 2-year period though, too, so it wouldn't be.
That's true. It'd be 12.5 each year, right? You're right.
Okay. Does any board member have any questions or comments on this before we vote?
I don't have any.
Okay. Then, Gene, your vote?
Yes,
Fred? You're muted, Fred.
Yes, I am. Sorry. Yes, my vote's a yes.
Thank you. John?
Yes.
Catherine?
Yes.
And I'm a yes.
Just to
Thank you.
clarify, this is to authorize Greg to sign as well.
That was my understanding. It wasn't actually part of the motion. Is there any objection among the board?
Not by Fred.
No, I don't. My understanding was I thought we were including that.
Just wanted to
So,
make sure for the record.
yes.
Good. Okay. Then item H3, this is the governance committee minutes. Gene, you wanted to discuss this?
yes. As I was listening to it, there was a point where Barbara Cassis used to be the board member assigned to looking into educational opportunities for the board. And there were several different opportunities, like whatever the name, what's the initials, ACHD or something like that?
Yeah. Mhm.
Okay.
Yes.
And last year it ended up being virtual anyway, and it's very difficult to network, but those things are invaluable for the board. And the board, the way I see it and the way it was and the way Barbara treated it, the management had nothing to do with that. It was the board. And the board selected someone like Catherine to investigate the opportunities that the board would have, then bring them to the board and say, hey, what do you think we should do? Well, that's Tim sort of went over Barbara's position and said, well, let's just not do that or not replace her or whatever. At the board meeting, what I was hearing, what were you saying, Tim?
I never ever said that because I wasn't even aware that Barbara was assigned that task.
Barbara
So,
was not assigned that task.
right.
Okay, well, that's
Education committee.
Right.
Which was an ad hoc on their end.
That was a committee of ACHD, not a committee of the board. So she agreed to participate on that so she could have access to the educational things and planning the educational programs for ACHD. That was a different thing altogether. So yeah, the way it worked primarily on the board at governance committee is that normally I will bring or other people will bring educational opportunities to the governance committee for consideration that we would then share with all the
hey,
board members.
you're our employee. You shouldn't even be involved in it. The board should be.
I'm more than happy to give that up.
The dumber, normally management, the dumber their boss is, the better off they are. And what do? We need someone like Catherine looking into educational opportunities. And can we set something up? Can you take it to the governance committee?
Ross this year.
Ross, and see if we can assign one of the board members to stay on top of it for us. And because the networking is important. And that meeting is not recorded, and the summary rather than verbatim, I can't go back but at any rate, it was sort of overlooked, was the reason that then I brought it in here. So.
Okay.
What do we do?
I appreciate.
Sorry,
you go ahead and finish.
Can you go ahead and how do we proceed? Can you ask governance to assign someone that could present it? Now, it's not going to affect me, but it's absolutely awesome to be able to network. And so at any rate, that's it. That's what I want to do, Ross. What do you think we should do?
Okay, thank you. I share your perspective on this. I agree with you.
Oh, no, don't do that.
Yeah, I know it's weird, but I think those networking opportunities are really valuable. And I think that the COVID situation has prevented us from participating in those. They've prevented them from being available for the most part. But so the governance committee, the members on it are, is not under my discretion as a chair. The governance committee is mandated to be the chairman and the first vice president. So John and I sit on that committee as a matter of our rules. And as far as, and board education is one of the things that falls under the governance committee. But that doesn't mean it's just John and I that should bring this up. I'm willing to listen to any board member who wants to address board education. I would love everybody's involvement with this. And so if you have things that you want the entire board to pursue, by all means, bring it to my attention and it will be part of the discussion of the governance committee. If any member wants to step up and do their own research and find opportunities that you think the board will benefit from, by all means, please do. I don't think that there needs to be a formal assignment. If somebody wants to take that on their own, by all means, do so. I don't know that this needs to be overly bureaucratic. The governance committee is a forum where we can use for this discussion. And I encourage any board member who has educational opportunities they want to present, bring them on. That's great.
What was Barbara's role, Tim? What did she do? Every year she was the one in charge of education.
No, she wasn't. That's not
Oh,
true.
she wasn't?
No.
ACHD reached out to her and asked her if she wanted to be on their education committee. She was also on their governance committee.
All right.
It was their committee, not ours.
Yeah, she was on their committee. Like I said, she was actually on our governance committee because of her position as first vice chair or board chair or whatever. So that's why she was on our committee. But as it related to what happened with education, that was purely between her and ACHD. Yeah.
Okay. Who would be the one that would look into it for in advance? Those things happen in October and November. And I know this is 6 or 8 months away, but
I seem to recall before COVID happened that even though we pulled out of ACHD, if there were classes or networking opportunities at ACHD, the district could still send an interested board member to one of those.
That is correct.
We were concerned about what ACHD was presenting once they stepped away from.
Because when I got on the board, there was a lot of networking. Not saying that there isn't networking, but like the last year or 2 years, it seemed like they had really condensed their annual.
As Beta left the organization and then Alpha Fund left the organization, the cash flow available to ACHD dried up to the point where and their opportunities dried up with that. There just wasn't the money to put on the big spectacular things, educational programs they did before. So I mean, I still think there's some certainly meaningful education that they put on. But like I said, we can certainly reach out to them and find out what their calendar looks like and so forth. Like I said, I think at our meeting the other day, I talked about a list that the Governance Institute is put together. And I think Heidi was going to get that out to everybody in terms of some of the classes that they've got coming up. Those are some things we should participate in. QHR, excuse me, QHR, not Governance Institute.
Yeah, QHR.
Yes.
You said that you were gonna,
Gene was asking me first.
you said QHR, you were going to send out a link at that meeting?
Yeah.
To the board members.
Yeah, I gave that to Heidi to send out. So I don't know.
We'll send it out immediately following this meeting.
She'll get it out to you today.
Okay. All right. Thank you.
You're welcome.
Okay, Russ, thank you so much for running your meeting overtime for a lot of my stuff, but I'm a lot clearer now.
Okay, excellent. So, Tim, does the California Hospital Association have an annual conference that is available to us?
They do, but again, for the last 2 years, that's been put on hold because of COVID. So now that things are beginning to open up, I'll go back and check with them and find out if they're planning to do one this year or not. Like I said, I think, Omicron, as we indicated earlier, is starting to begin to trail off pretty quickly. I've not heard anything from any of the organizations about anything coming behind it yet. But, I'm sure it will still be around in some form or other. But like I said, I think you're beginning to see more and more organizations put on their in-person training programs again. So we'll reach out and find out.
Great. If those opportunities come up in the future, I know it's going to be dependent upon what our pandemic situation looks like,
Yeah.
but CHA is a great organization and they've got a lot of money, and I imagine that their annual conference is probably pretty diverse.
Yes, they are.
And there may be a lot of things in there that go beyond just the district perspective, but just that would be of interest to our board in terms of hospital operations.
You bet. I'll get back to everybody after I find out.
Terrific. And like I say, don't just because John and I are the only members to the governance committee, please bring your ideas for education to either him or I, or directly to Tim, and we'll make sure it's discussed. And for that matter, we can discuss it at the board meeting as well. I want you to be able to get the education you're looking for and need. So don't want to be any restrictions there whatsoever. Okay, let me find.
Out of the way.
Good job.
We're not going to have to adjourn, are we, Ross?
Oh, no, we can keep going if you want.
Sorry about
Okay,
that.
so we're at item I, director's comments on items not appearing on the agenda.
Ross, point of order, you gotta approve the minutes because they were pulled, the governance committee meeting minutes.
Oh, thank you, John. Yes,
So
we do.
I'll move to approve those.
I'll
Thank you.
second.
Do we have a second?
Yeah, I'll second.
Thanks, Gene. Any comments or discussion? Members of the public wishing to be heard? Okay, seeing none. Gene, your vote?
Yes.
Fred?
Yes.
John?
Yes.
Catherine?
Yes.
And I'm a yes. So now we can move on to director comments. Catherine, we'll start with you today.
No comments.
Thank you. John?
I don't have anything particular today either, Ross. Thank you.
Thank you. Fred?
Dave, I'm just looking forward to that report when you get it finalized, because I would really like to know what we have in the bank for our construction project. But other than that, I love your reports. Thank you for everything you do.
Gene?
I just want to make one comment. I don't want anybody on the board that don't agree with me. So you guys are going to have to straighten out. That's
I
it.
guess I'll be quitting.
Russ, you don't have to be honest.
Gene, I know we don't always see eye to eye on stuff, but I appreciate you bringing up the things that are of concern to you. I think that makes us a valuable, I think it makes us a well-functioning board. If we all just sat and said yes and always agreed, then I don't think we'd be doing our job. So appreciate you.
And I'm sorry it took so long today. Try to make it shorter. Thank you.
Okay. All right. With that, folks, then we are adjourned. Have a good week, and we'll see each other in committees before too long.
Yeah.
Thank you.
Bye.
See you guys.
Everyone. Bye.
Bye.